Hi, I'm Samantha Harriman. I'm the COVID Project Manager for Digital Health at Alfred Health. The objective of my role is to be able to take on any new work projects that were coming through specifically related to COVID and to relieve the pressure of some of the other teams within digital health at Alfred. Some examples of the issues that we had to deal with was related to visitor management and being able to be safe for our patients and our staff initially. It was also to have adherence to all the Department of Health requirements that were constantly coming through and being updated as more information came through, and also to manage our staff. We needed to come up with new technologies, we needed to come up with new processes, and we also had to deal with staff shortages. One was to handle our visitor management and issues around screening for the hospital, but also then to have a digital solution for our Hotel Support Services who managed all of the quarantine hotel for positive COVID patients in Victoria. Some of the integrations that were required were to work together, the two systems to be able to work together, but more importantly, we needed integration with our electronic medical record. The importance of these solutions being digitised was extremely high. Digital meant not only an ease of use and practicality, but it also meant that we had visibility and transparency even if we were off-site, which was particularly important for our Hotel Support Services Concierge. Yeah, after the initial launch of both the HSS Concierge and the visitor management system, you can imagine they were not static solutions, that there were ever-changing guidelines from the Department of Health. There were different requirements within the health service itself, staff changes, etc., that required us to build out the systems. We were able to have quite dynamic changes made within the system on the fly, some within short time frames of only 12 hours. And then we were able to work with the project teams to have a lot of these components of the software configurable by us so that we could, at the drop of a hat, make those changes when needed. In relation to these projects, the thing that I'm most proud of is particularly with the HSS Concierge project. That 2-week time frame was unbelievably tight, and being able to get to the end of that and look at my list and know that I'd ticked every box of the requirements and in time and in scope and in cost, it was an extremely proud moment for myself and my team to see that. The response from the public in particular with our visitor management system has been really well received. We hear a lot of visitors telling us how much quicker and easier it is to get into the hospital without having to queue to answer questions, because they can answer these questions on their own device even before they walk in the door at the hospital. I think the appetite for digital workflows has astronomically increased. I think there is now a demand and almost an expectation from people that things will be quicker, that they'll be easier, more accessible, and that they can do it on their own devices.